My name is Rashmi Halker Singh, and I'm the Deputy Editor of Headache. It is my pleasure today to be joined by Dr. Elizabeth Ackley, who's one of the lead authors of a recent publication entitled Dots and Spots, a retrospective review of T2-hyperintense white matter lesions in pediatric patients with and without headache. Welcome, Dr. Ackley. First of all, can you tell us what do you mean by dots and spots?
Hi, Dr. Hacker Singh. Thank you so much for having me today. So dots and spots are referring to the white matter lesions that we often see pop up on MRI reports. So when I was in child neurology residency, I actually remember receiving a call overnight from a very worried endocrinologist who had ordered a brain MRI on one of her patients. And she was very concerned when she got the report because it read that her patient had a small T2-hyperintense white matter lesion, so a little spot or dot on his MRI. And she wasn't really sure what to make of this. She wasn't sure what follow-up was needed and if this spot changed the clinical picture at all for her patient. And I think a lot of us have run into similar situations where an MRI comes back with these kinds of dots or spots in the report, and similar questions might come up. And in my training, I often heard people refer to these spots as kind of migraine spots based on the association that we know exists in adults with migraine. But we don't really have a lot of pediatric data to know if those increased rates of white matter lesions that we see in adults with migraine also holds true for youth with migraine. In fact, based on our own experience, we actually felt that these spots were probably incidental and not related to migraine or other headache disorders.
Yeah, I was really interested in your paper because, I'm an adult clinician and I see these dots and spots, as you call them, in my patient population all the time. And when I do order MRI scans in adults who have migraine, I will often counsel them, even in advance of getting the study, that I might see these findings and give them some education about, our understanding of these non-specific findings and what we think about them even before I order the studies to hopefully make sure that they're not as worried about the findings. So I was interested to see what we know about them in the pediatric population. So tell us about your study.
Yeah, so to investigate what the relationship is between these dots and spots and kids who have migraine or other headache disorders, we did a retrospective cross-sectional study at our institution, which is a tertiary children's hospital. And we looked at patients who were ages 3 to 18 who underwent brain MRI for any reason over about a span of a year. And we took out any patients who had any kind of known CNS pathology or anything that would impact their white matter appearance. And then we looked back at their charts. We pulled out the folks that had migraine or other primary headaches, and then kind of identified our controls who did not have those headaches. And then we had our pediatric neuroradiologist review all of the scans and tally the number of white matter lesions on each of them. And then that allowed us to compare the number of lesions between the groups.
So what did you find? Did anything surprise you with this data?
So we were actually able to support our initial hypothesis that these lesions were probably incidental and not connected to migraine. We found that white matter lesions were very, very common across all the groups, so an overall prevalence of about 40%, and there was no significant difference between the headache groups and the control groups.
I think that's really interesting. Has this impacted the way you counsel your patients at all?
Yeah, so certainly, because there was no difference in the number of dots and spots in the headache groups compared to the controls, like I said, this supports that these spots are probably incidental in nature. They're probably more of a reflection of a physiologic process, so perhaps related to something like enlarged perivascular spaces, as opposed to a pathologic process. And so that's important because if they're not pathologic in nature, then we can certainly spare children from getting unnecessary follow-up scans or other tests to track these spots over time. And we can also reassure families, right, that these spots are very common. We see them in kids with headache, we see them in kids without headache, and they probably aren't progressive or harmful in any way. And they also don't rule in migraine, which I think sometimes these spots falsely, reassure clinicians that, the diagnosis really is migraine here, and that's not necessarily the case. And I think, sorry, go ahead.
I think that's a really important point as well. We don't have imaging findings at this time that will support the diagnosis as a clinical finding. So yeah, very good point. What were you about to add?
I was just going to say, actually, potentially the most important part of this, I think, is that it could change the way that we report these dots and spots in radiologic reports. Because I think if they're considered to be within the spectrum of normal, a radiologist can potentially describe them in the body of the report as opposed to within the impression. Because I think when you put them in the impression, that might be really confusing for the ordering MRI provider, that this is a concerning finding, this is worrisome, this potentially could, require more workup or testing. But if they're, in the body of the report, that I think implies that this is not a concerning or worrisome or abnormal finding. So it could really change the way that we report things and how ordering providers are understanding the results.
Yeah, I think that has a lot of clinical implications. I think that's a really important point. Well, thank you for providing this work. I think this adds a lot to the way we take care of our younger patient population who live with migraine.
Thank you so much. Yeah, it was really interesting to do the study, and I'm so glad that we were able to get a little bit of a better understanding of the significance or lack thereof of these dots and spots.